Okay, today's topic is health systems in India. It has three links. First one is a central level, second one is a state level, and third one is a district level. Today we will see about the central level. First one, what the decisions are making in the India or any country, that will be at the central level. Of it may be also internationally also. So it has mainly three levels. First one is this is a state subject under the Constitution of India. All the levels and mostly depends on the central level, because all the rules and regulations formed by the only central levels. Then it will pass to the state level, then it will pass to district level, then it will pass to the different type of the area, like villages or towns or urban or rural areas. Today we will see about the central levels. There are mostly the central is responsible for the execution of health programs in centrally administered area. Centrally administered area means to whole out the countries. The central's decisions is rule out the for the whole out the country. It also has and states all the state members, like officials organ or the health system at the national level consists of first one the Ministry of Health and Family Welfare, second one is the Directorate General of Health Services, and third one the Central Council of Health and Family Welfare. Today we will see about the first one is the Ministry of Health and Family Welfare. What he is going to do, what he is follow the rules and regulations, what is his functions. The responsibility of the central and state is the area of health are defined under Articles 246 of the Constitution as follow. This is the Article 246 that he has to do that functions. First one is it has two unions, union list, and second one is a concurrent list. The first one, union list. The international obligations such as international sanitary regulations regard for the port quarantine. It means if there is an international obligation such as international quarantine is followed, then our national, our central levels, what happened? They going to do same things in the central regulations. They also follow the same rules and regulations. Administration of a central institute such as all India's Institute of Hygiene Public Health Centers, like Kolkata National Institute of Communicable Disease, Delhi National Institute of Health and Family Welfare. It means if this decision is taken for the hygienic and public health sectors, that will be done by the only Kolkata and Delhi in India. Third one is the promotion of research through the bodies such as Indian Council of Medical Research. If there is a medical research promotion is needed, then the decision taken by this union list by centrally. Regulation and enrollment of the medical, dental, pharmaceutical and education, nursing education professions to their respective councils. If there is a related to paramedical and dental services, they will be also going to regulate by the and also going to see by this committee, union list. Fifth one is regulation of manufacturers, sales and of the biological products and drugs, including drug standards. What if there is a coming drugs in the market? It may have side effects. It may have some extra effects. Whatever the regulation of manufacturers, regulation of company manufacturers, that is done by this union list. Undertaking census, collecting, publishes health and vital statistics data. It means there is a every 10 census what is going he is going to the research out that after some times which which disease is occurring, so that census is passed with the census data and ratio is passed by this union list. 7.1 is the coordination with the state and their health programs, giving them technical and financial assistance purchase for the facility from the international agency. Like facility from international agencies, we have to apply from them. We have to request for give the financial support for them, technical support. So that coordinations will make by this union list. Coordination with the other ministry of matters related to health. Coordination with the other ministry. The coordination means the other countries, coordination with the other prime ministers, that done by this union list. Health regulation regarding labor in general and minus all fields in particulars. It means Health related to labor conditions, health related to oil fields, also going to take decision by this union list. In concurrent list, what they are going to do? In concurrent list, both the central and state level has limited power of legislations relations to subject in concurrent list. First one is the interstate spread of disease. Interstate spread of disease means the disease pass out from one state to another state, that regulars that research is done by this under the concurrent list. Second, prevention of adulteration of food. Some diseases occurrence by the prevention of alteration of food. It means sometimes what happen, the food poison is done by the some alteration of food, that regulations and the preventions done by this under the concurrent list. Third is the control of drug and poisons. Some drugs having the some side effect, that controls is needed for manufacturing is also going to deduct. That's why this union, what they do, they may consent. Poisons related like narcotic test, narcotic drugs, and high risk drugs, that regulation done by this concurrent list. Then fourth one is a vital status. Vital status, it means how many birth has going in this area, how many death are going to area, how many mother it's in pregnancy. That vital status ratio will be prepared by this person. Labor and welfare. Labor and welfare, it means the labor work. You may know some children is going to do the labor work right now. So what happened? The labor welfare committee, what is going to do? They will this deduct. They will going to stop this labor work. There's also commons this union. Minor parts. Minor parts, it means the minus errors what is going to be done with the disciplines. So that will be deduct by this concurrent list. Population control and family planning. Everyone control is needed. Population control and family planning. The rules and regulation related to this population and family planning, like medicines, like property, like sexual educations, that are also done by this committee. And 8th one is a social and economic planning. Social and economic planning is very necessary for our country, because if our economic country is strengthened via the financially, that will really improve our growth. So this is main functions of Ministry of Health and Family Welfare. The first person who is going to look out two type of functions is union list, which is centrally, internationally, and our concurrent list, which is focused on mainly subtype of diseases, some type of food, some type of drugs, some type of vital statistics, labor work, populations, and economic planning. This is a two type of the work done by this ministry. This is a first person, the Ministry of Health and Family Welfare. This is a very important person. Is going to look out the overall growth of our country as a health. Thank you, everyone.
Okay, good morning, students. Today we will see about the CHN2. Your health system in India has three links. Yesterday we have the central level. Today we will see about the state level and district level. What do you mean by state level and district level? But before going to start, I revise my topic at the central level. What you mean? It has three level consist of the Ministry of Healthcare and Family Welfare, the Directorate General of Health Services, and the Central Council of the Health and Welfare. Yesterday we will see in the Ministry of Health and Family Welfare. Today we will see about the second one, the Director General Health and Services. The main function of this Director DGHS, it means conducting various national health programs, like which is going on in the school, which is going on the like midday programs, labor related programs, whatever program is going to be conducted, which also conducted by this Director General of the Health Services. Second was organization health services form of the central government health schemes. Central government health schemes like on the different type of the disease conditions like communicable disease conditions or any which is occurring to the scenario wise like in the census wise. So which also consists of this DGCS. Providing medical education through the college institution under the control. Rajkumari, example, Rajkumari means College of Nursing, Delhi, All India Institute of Hygiene, Public, Kolkata, or JPMER, Pondicherry. Like providing medical educations, the college. If we provide medical educations, that increase the scenario of the medical education towards the all age, like towards all the countries also, towards all the nations also. So it's that that education level we're going to increase. With that medical education that we provide, that they come to know the prevention promoting care of the health. Fourth one is medical research through Indian Council of the Medical Research and the institute under it. It also other institutes such as Central Research Institute, Kausali. It means if we provide medical research through Indian councils, what happens? We can come to know about by the research. We can come to know what the problem is going with the last year and what the problem is from last census. So we can research on the medical field on the different type of the sign and symptoms as well different types of the communicable, non-communicable disease. So we can come to know in that we can also which type of the disease will come in future, and also we can minimize the barrier which we have done in previous studies. International health and quarantine are the major ports and international airport. It means international health and quarantine, so major ports. It means now scenario is going to international health. It means all the countries are suffering with this corona. It means international health is a pandemic disease. The quarantine is very necessary. At the time of what happened, this DGCS is going to take the decision for the quarantine period. Drug control. Drug control, it means many type of the drugs are coming in the thing. Not alcoholic drug. Many types of the drug is coming in the this nations. So what happened? It may effective, it may not be, it will verify with the WHO, it may not verify the WHO. What happened? It may having side effect. That's why drug controls supplements it's necessary and it is done by the DGHS. Medical storage suppliers. What happened? Pharmacies are right now trending. They come to know that medicines are very important in this country. So what happened? They illegally they provide the medical stores. They build up the medical stores. That's why these legal actions should be taken by the DGCS for medical opening stores and the suppliers. While suppliers we are talking about. Health education, 8.1 is health education through Central Health Education Bureau. It means every district having that education bureau. According to that, they decide the syllabus of the health educations for the learning students. For that, the bureaus research for the students, their level of studies, and then the educations take the health educations take the this decisions for syllabus. Ninth one is health intelligence through Central Health Intelligence Bureau. Health intelligence is means in which area they are lacking in the health education. So they will maintain the ratios and then they provide the health educations by the ASA workers or by the different type of the sectors. So these all are comes under the DGCS functions, which also it's a nationally also, internationally also, districts and centrally also. That's why it's come under the central level. Third one is the Central Council of the Health and Family Welfare. What happened? The function of Central Council of Family Welfare considers the recommended broad outline of the policy in regards to maintain considering health in all aspects such as provision of free medicals and preventive care. It means provision of free medicals. Free medicals matlab ki who has already disease and preventive care, and that we have to prevent for the disease. This comes under the functions of Central Council of Health and Family Welfare. Another, environmental hygiene, nutrition, health education, and promotion of facility for training and research. It also comes under the functions of the Central Council of Health and Family Welfare, because so many diseases occurrence because of the environmental inhygiene. What happened? Due to some breeds or due to some mosquitoes, environmental hygiene related disease can be occur. So it's a lookout. This lookout functions by the Central Councils of Health and Family Welfare. Nutrition, in the sense of the malnutrition babies, also they research for the malnutrition babies and provide the nutrition in the by the some of the programs like day meal programs. Second one, to make proposals for legislations in the fields of activity related to medical and public health matters, to lay down patterns of the development for the country as whole. It means legislations, it means legal actions. Some fields of the activity related to medicals, like medicals permissions for developing the nursing college, developing the medical college, paramedical college. To that legislation, the legal actions will be provided by this function of Central Council of Health Family Welfare. We have to take the permission from this person. Third, to make recommendations to the central government regarding distributions of available grant in health purpose to state, and review periodically to work completion different areas through utilization of this grant in hand. Grant in hands, you may know in like government providing some programs. They firstly they give the ads in the TV's ads or radio ads. So what about that? Firstly, we have to take the permission for that ad. So all some medicines, if we going to apply in our country, firstly we have to give the WHO recommendation, then we have to give the ads for publications. So what happened? These publications ad permissions given by this person. Fourth one, to establish any organization invested with the appropriate functions for promoting, maintaining cooperations between the central and health state administration. It means what the decision central level is taking, it has to pass to the central levels, from central levels to the state levels. That has to pass by the central levels to state level, and this person will going to pass the all which criteria from central to state level. This is a function of that person. Now we will see about the state level. We have seen about the central level. From central level, there are 3 persons are recommended. Revising my topic, 3 persons. First one, Ministry of Health and Family Welfare. Second person, the Directorate General of Health Services. Third person, the Central Council of Health and Family Welfare. Now we are going to see about the state level. What happens state level and what are the members of the state level committees. There are 29 states in our countries right now, but before sometimes 28. Health is a state earlier to state subject. It means health is very important for all the scenario, as mentally, physically, socially, spiritually. Health should be complete state. Therefore, the pattern of organization state for integrations, level of health services, public health laws, spells may differ from the state to state. What happened? The scenario from state to state will be going to change, because all the state having different type of the diseases, all the state having maybe different type of economical status. That's why what happened? The organizations and state integrations will be going to change from state to state. Like what applying in the Maharashtra should be not applying in our Gujarat, because state to state the scenarios will be going to change, and economic status, population status will be also going to change. That's why what we are applying in their state, we can't apply in our state. If there be a central level that we can apply, if there be state level we can't be applied. That should be not same. The aim, however, all the state and their public administration need the same health, happiness and loyalty for all the rep. But the main goal of the state level persons is our state should be a happiness, longevity and same health for the all. There should be happiness. Okay. Now we'll see about the persons who are included in the state level. First one is the State Ministry of Health. State Ministry of Health. The State Ministry has the mentions Deputy Minister of Health and Secretary and Joint Secretary, etc. held by the IAS cadre. You may know State Ministry of Health is providing the legal actions about the health in their stage. Second one is the State Health Director. The State Health Directorate is a process of elections has now been completed in the most stage. The usual pattern now is also State Health Director is held by the director of that family or that community. Usually known as the Director of Health Services, he is associated with a suitable number of deputy to look out various type of the health and medical research services. Some states also have a separate Director of Medical Educations. Because of this, it varies from state to state. It also varies from language to language. You may know, whereas we can use the Gujarati language because their stage is different, our stage is different. So it may be changes from medical services and health services from state to state. It would be going to separate, and this separate decision is done by the State Health Directorate. Now third one is a district level. It means first one we have central, second one is state, and now in that we are going into deep. This is a district level. Like my district is Anand. So what happened? Our district level health and that policy will be going to change from another district because our population is our community is changed, our area is changed. So also rules and regulation will be going to change. Each states in India are divided into district. Total population in each district, urban as well as rural, varies from 1 to 3 million because district also comes cover the urban and rural area both. So there will be a huge change in the population. Just as in case of the states, some autonomy had been given to urban and rural area and district as well. The autonomous body of the local self-government are called corporations and municipal commission in cities. Like we are going to change self-government change. I like what sometimes Anand this is going to sanitize by these persons. What happen if they research and they come to know that it having unhygienic conditions? So what apply they apply the sanitization area. This rural and urban area, these regulations in rural and urban area is taken by these persons. What are the persons? Now we'll see about the health regulation in urban area, how they maintain. There are three types of self-governance in urban area of district depending upon the size of population. First one, town area comprises 5,000 to 10,000. Municipal boards and municipality covers 1 lakh to 2 lakh. And then corporations contain the 2 lakh. Town area committees function primarily limited to provision of sanitary services. As I told you before, firstly, town area committee, what happened? If they come to know if they are having town unhygienic, what they apply this sanitization in that area. It means if my town Anand is going to unhygienic, what happened? This person's district, what he is in district level, is going to be sanitized in my town. Second one, municipal boards and municipality, its function are more diverse. This includes regulation, house, latrine use, hotels and market. What happened? The second person, municipal and board municipality, what happened? They are going to see about the conditions of their town, like house conditions, latrine and urinary conditions, for how many hotels are in that town, and about the market conditions, like in our Anand, so market is going to be huge. So what happened? There may be chances of getting the more infections. So this person, what happened? This person will apply the some rules and regulation on that in this scenario, like in the market, in the house, or the latrines, and hostels or hotel also. Provision of other than provisions of water supply, drainage, disposal of refuse and excreta. process of end date and registration of the birth date, keeping to the dogs and controllable diseases. Which controllable disease? Communicable diseases. So this all our scenario is going to be done by the municipal boards and municipality, mainly from our house, water supply, drainage systems, disposal of refuse, etc. Disposal of dates and registration of birth and death. Registration of birth and death is very important because they come to know how many are births in this year in the town, how many deaths are there. They come to know about the populations. They can count the population scenario. Also, they can know about the animals also, that how many animals in their town. Third one is corporations. Each can receive more area. Corporations provide essentially the scheme services at the municipality, but not larger scale. So also maintain hospital and dispensaries. It means corporations only on the corporate area, like you can say about the you can see in Anand there are so many of hospitals. That hospitals build up it does with the corporations. That comes under the corporations. They have to take the permission from these corporations to build up the any hospitals or multi-specialty hospitals or any more cells or any more malls. If they have to build up, they have to take the permission from the desk corporation. They the corporation having the authority at the last says to give the permissions from the dispensary also, for the hospital also, for malls also. Now we will see about the health education rural. Previously we have seen about the health education in urban area. Now we will see about the health in rural area, how they take the permissions, how they can regulate. Health education is a rural area. Under the Panchayat Act 1961, the district administrations were recognized into three levels. Self-governing autonomous bodies were formed at a different level as the follow. As I told you, rural area, it's a controlled by the panchayat. If any panchayat take the decisions, they comes to they have to apply that particular village, and panchayat is a part of the village. So firstly, they will take the decision for the any conditions of the village. First one, for each group of the village with population from 1,000 to 10,000, there is a Gram Panchayat. As I told you, if there is a village and population is covered, the 1,000 to 10,000, the decision will be going to take by the Gram Panchayat. If the population is over 10,000 to 30,000, there will be a Nagar Panchayat. If the population is more, then it will be taken by the decision only for the Nagar Panchayat. The Gram Panchayat is considered by the 50 elected members who is turned into Sarpanch or Presidents, by Presidents, and Panchayat Secretary is selected by the government. They have to know the government, that who is the presidents of this panchayat, who is a sarpanch, who is a vice presidents, and 15 to 30 members are elected for this Gram Panchayat committee, and all the decisions taken by this Gram Panchayat in village. If they cover the 1,000 to 10,000 area, if they cover the 1,000 10,000 people, there will be another is a Nagar Panchayat. Second one, for the each block there is a Panchayat Samiti or Taluka Panchayat, which is a elected body, and the third one is for each district there is a Zilla Panchayat or Parishad, which is an autonomous body for the district as well as who will responsible for the assembly. It's depend on the population. If there is a Gram Panchayat, the population will be low. If there is a Nagar Panchayat, the population is more. Then if it is a population greater than 30,000, what happened? Panchayat Samiti and Taluka Panchayat. And if there is more population, then what happened? The Jilla Panchayat will take the decision, or Parishad will take the decision. It depends on our coverage. It depends on the population area. It considered by elected member, MLAs and MPS. If there is a Jilla Panchayat, so all the decisions will be taken by the MLAs or MPS. In all, above provisions has been made for the reservation for scheduled caste, scheduled tribes, women to ensure their active participation in all the development of the village. Firstly, all the members will look out the
scheduled caste, all the members look out the scheduled tribe. It means ST and ST basic category. They also know about the women's, like their empowerment is done or not. This all the category, it's visualized by this Gram Panchayat, Jilla Panchayat and this Taluka Panchayat. Thank you everyone.